Hi, I'm Dr. Lisa Gordon at the Natural Health Improvement Center of Columbia, Maryland, and today I'd like to tell you about my own health journey. I've been a chiropractor for 34 years, and I've been doing other really wonderful holistic health care for much of that time. So I wanted to talk a little bit more personally today. Sometimes I'll go into a doctor's office and I don't know who that person is, and I feel kind of exposed, and I'm being asked a lot of questions about me and about personal things, and I don't know at all who I'm talking to. So I wanted to let you know how I reached this point in my life and why I do what I do, and something about my own health journey. So what happened in my health journey was that when I was younger, when I was in high school and college, I had a lot of allergies and repeated sinus infections. I had terrible headaches and bad menstrual cramps, and some people think, well, that's just typical growing up. What was suggested to me was that I take this medication and that medication, and I just didn't feel well when I was taking them. So I kind of even back then started to wonder whether there was some other way of handling these issues. And then when I was in college, I fell down a flight of stairs, and I was pretty badly hurt. And the medical doctors that I went to said, well, you have to take this medication for the rest of your life. And it wasn't satisfying to me at all, because after taking it, I couldn't study, I couldn't really think. It was impacting me in ways that were not acceptable to me. So I eventually took the advice of a friend of mine to go to a chiropractor, and I was not raised with chiropractic. I didn't know anything about it. So it took me about 3 months of being in pretty severe pain before I went to this chiropractor, who was able to help me. And that got me thinking about what I wanted to do with my life, and I kind of wanted to be very much like that chiropractor. So that started my journey along becoming educated regarding chiropractic. And in fact, when I went to chiropractic school, I went and worked with my first chiropractor and learned from her through my entire schooling. So that was a great benefit to me, and I think it made me in large part the chiropractor that I am today. As I went along in my life, I have had other health issues. I've had infertility, I've had migraines, I've had thyroid disease, hypothyroidism, I've dealt with depression, infertility, lots of different things. And most of the time there was some medication that was suggested to me or that I tried. The only medication that I'm on still is thyroid medication, which I have been on for over 30 years because I was just so exhausted that it took me around a year to decide to go on to any medication. But over the years, I realized that there were natural medications that worked better for me. So for many, many years, I've been on natural medications for my thyroid, and I'm okay with that. I'm 64 years old now, and most of the people I know who are my age are on a list of medications, and I'm not, because I was able to find ways to help myself to get practitioners like me and others who are in supportive professions to help me to be well without medication. So for my own health care, I use acupuncture, I use chiropractic, I use nutrition response testing. I myself am a nutrition response testing patient, and I find out on a regular basis what my body needs. And this is what I do for my patients as well. Over time, things change, and so I get checked myself. Another piece of my health history has to do with my genetics. Both of my parents have passed away now, my mother of her own hand, and they both had Parkinsons disease. My mother's Parkinson's disease was complicated by something called dystonia. She not only had the tremor of Parkinson's disease, but she had horrible cramping in her body that was so painful that she actually did end her own life because she could not tolerate that anymore. She was also on a lot of medications, so was my father, And I wonder sometimes whether some of their symptoms may have been resulting from side effects from the medications. I do recognize that when somebody has severe illness, that medications can often be very helpful. And I also think that it could be that some of those medications could be minimized if the person was able to find out exactly what imbalances were in his or her body and get those things handled naturally. So I tried to help my parents, but back when my mother was alive, I didn't know as much as I know now. The chiropractic adjustments certainly helped her with the Parkinson's. She would feel calmer. The disease process did its thing, and I was able to help her a little bit. But that was many, many years ago when I was early on in my career. My father was less open to getting treated, and I didn't live near him, so he was fearful. Both of my parents were fearful as a result of their disease process. And my knowledge now is that we all have the genetics that we have. Those do not need to be manifested in disease if a person is as healthy as possible. I believe, and I have seen in my practice and in my family and in myself, that it is truly best to stay healthy with natural means. So a good lifestyle, the proper supplementation. And that's part of the reason that I do what I do, because I want to know what each individual person needs. I want to know what I need. I want to know what my children need. I want to know what my friends and my patients need so that they can stay healthy and avoid going down that kind of rabbit hole of medication side effect, medication side effect, medication side effect that becomes very complex and it's very difficult to unwind. So I just wanted to let you know that I have been through a lot of the things that you have been through. So I can sit with you, I can be with you, I understand. I really understand a lot about life. I've been through a lot, and I hope that makes you feel comfortable about coming to me, about giving me a call and maybe setting up a no-charge consultation with me to see if it's the right fit for you, to look into the possibility of staying healthy naturally, even getting healthier naturally. You don't have to just avoid illness, although that's the ideal. We can also get well using natural means. I see it every day in my practice. I'm thrilled to be able to help people, and I'm also really happy that I'm not on a lot of medications. If you'd like to learn more about whether this sort of care is right for you, please reach out for a courtesy consultation by calling my office.